Impact Model for Change series is funded under the federal 21st Century Cures Act as part of Ohio's state targeted response to the opioid crisis. As you all know, the Ohio Department of Mental Health and Addiction Services has awarded funding to 12 Ohio communities to address opioid use and misuse by combining a strategic planning process with an emphasis on working across the continuum of care and utilizing a trauma-informed approach. Ohio MOS has also partnered with The Ohio University, the Pacific Institute for Research and Evaluation, and the Prevention Institute to develop training and technical assistance, along with evaluation services to the 12 communities. Our goals are to prevent opioid use and abuse, reduce opioid-related deaths, and increase access to treatment, including medication-assisted treatment in the state of Ohio. On the slide in front of you, you will see a website that you can access to gather more information on the initiative. The webinar series aims to bring together those in the field to share their experiences, successes, and challenges, and offer nuggets of wisdom to communities that are facing similar issues and challenges. It is also meant to provide additional resources, strategies, and content to our communities, their partners, and those working at the local, state, and national level to address opioid use and misuse. Today's webinar presenter is Dave Wallace, who is the Director of Health Policy at United Way Worldwide, and we're really excited to have Dave today. Dave is going to be sharing more with us about United Way's opioid work group, and we'll also be sharing more about how United Ways are working in their local communities around prevention, trauma-informed care, and treatment. I'd like to welcome you, Dave, to today's webinar, and thank you for agreeing to share all the great work you guys are doing through United Way.
Thank you, Dana. Can everybody hear me okay?
Yep.
Great. Well, I'm very excited to be here and to share the work that United Way is doing. And just, I really applaud what you all have begun doing in Ohio with your work, the Prevention Institute's work, especially at the community level of trauma you're addressing. I think that's so critical if we are really going to bring some significant change that brings this epidemic to an end, and really looking at what can we do at a community level to support not only treatment and recovery, but support the prevention of crises like this happening in the communities in which we live and work. So I think what you're doing is really, really critical to, and very much part of what United Way's role is in communities as well. So thank you for that. Just real quick, what I'll be going over with you today is just quickly share our role here at United Way, kind of how and why we got here in this opioid crisis space. Talk a little bit about the United Way National Opioid Work Group that we activated over a year ago, and then spotlighting some of the work that we're doing in communities. And I'm going to spotlight just 3 United Ways, but just be aware that we have hundreds of United Ways that are doing work in all different arenas in response to the opioid epidemic. So around prevention and public awareness, I want to highlight the work that United Way of River Cities is doing in Huntington, West Virginia. Then on the prevention and treatment side, United Way of Greater St. Louis is doing some amazing work with postpartum mothers. And then trauma-informed care, United Way of Greater Philadelphia is doing tremendous work in that southeastern Pennsylvania, southern New Jersey area. So let's get started. So how do we get here? For context, United Way fights for the health, education, and financial stability of every person in every community. We have over 1,130 local United Ways in our U.S. network alone. And so this means that there's a local United Way in every congressional district in the U.S. And this enables us to reach every member of Congress and district on our federal policy priorities. Each United Way is focused on specific issues in their community in those areas of health, education, and financial stability. United Way Worldwide provides structure, technical support, and issue expertise, but local United Ways are the ones who determine their own priorities within those issue fields, based on the needs that they have in their own community. I'll also mention that local United Ways fund programs in their community. They lead and fund initiatives with multiple partners in their communities. And in many communities, United Way is the largest non-governmental funder of health and human services. So the role that United Ways play as not only convener but funder can be very critical in a lot of the communities that we serve. But also know our network is very diverse. So we have many United Ways across the country, and probably the majority of them are very, very small in rural counties. They may have one staff person or a volunteer staff person, and then you have very, very large United Ways in metropolitan areas across the country. So local United Ways are experiencing significant impact from the opioid epidemic in their communities. We reflect what's going on in the communities in which we serve. United Ways, for United Ways, the process of being engaged in the opioid epidemic has been very organic and grassroots driven. Most of our federal policy issues are kind of a top-down strategy and a process where we're engaging and coordinating local United Ways on issues here in DC at the federal level with the U.S. network. But with the case of the opioid crisis, that process has been reversed. Because the health crisis is impacting local communities with different dynamics and based on local circumstances, local United Ways are responding to the crisis in much different ways. So we see them participating or leading local coalitions. Many of them, and probably the vast majority of them, are driving public awareness campaigns. We see a lot of work in prevention, especially youth prevention. Less work, but some significant work in either treatment programs, especially funding treatment programs. And just overall, collectively as a network, United Way is making some significant investments in their communities. Just in the area of mental health, we have over 577 local United Ways that are investing over $60 billion in their communities on mental health programs. Around substance abuse, we have over 353 local United Ways, spending almost $26 million in their local communities. And then other related programs, especially around crisis intervention, and this would include trauma-informed care. $73 million is being spent in local United Ways, and around child welfare specifically, almost $67 million. So United Ways across the country in local communities are making significant investments to move the needle on some of these issues around behavioral health, substance abuse, and related crisis intervention. So just to tell you a little bit about the opioid work group and how we're using the work group to engage our network. Back in January of last year, we sent out an invitation to all the local United Ways and state associations across the U.S. To join this work group. To date, we have over 70 local and state United Ways, including Ottawa, Canada, so that, I guess that makes us international. And with that work group, we have monthly conference calls. Those conference calls will range on a variety of topics, try to get experts in the areas of prevention or treatment or other related issues to present on our calls. You all presented an amazing presentation on community level trauma last year, which was really well received by the work group. And then every week we send out a digest that has resources, events, news articles to help keep our network informed on what's going on in the space. We also use United Way has a Workplace by Facebook platform that we use to share resources and ideas among U.S. network and United Ways that are specifically engaged in the opioid crisis in their communities. The work group has two main purposes and goals. First is to advance data, resources, and policies to support prevention and treatment strategies that are happening locally in communities. But also, and probably the biggest thing that we're using this for, is to provide a platform for United Ways across our country to share their ideas, best practices on how to respond to a crisis in local communities. And often with our monthly calls, we will spotlight the work that a specific United Way is doing in the area around prevention or treatment as a way to help inform the network and provide that sharing of best practice. So I want to continue by spotlighting the work that we're doing in communities. And again, I have a lot of United Ways, not only the 70 United Ways that are part of this work group, but other United Ways across the country that are doing some significant work in addressing the opioid epidemic. But wanted just to give you an example of what that looks like in local communities. So first I wanted to share with you the work around prevention and public awareness that's happening in Huntington, West Virginia. And just as a quick aside, before I came to United Way Worldwide 2.5 years ago, I was at United Way of Broward County in Fort Lauderdale, Florida, for over 10 years. United Way of Broward County has been working in the substance abuse space for over 30 years. We lead a very robust, vibrant Commission on Substance Abuse and have been at United Way. I've had the benefit of seeing the work on the ground that United Way has been doing in addressing many crises that have happened, especially with the opioid epidemic that we're seeing now. So just wanted to let you know I have a strong background in seeing what this looks like at the local level. So in Huntington, West Virginia, we have River Cities created a substance abuse prevention partnership. They wanted to go from being known as the overdose capital of the nation and ground zero for the opioid epidemic to turning the tables and making an impact as that little coalition that could. So the Cable County Substance Abuse Prevention Partnership began in 2006. A lot of their work is being funded through a 10-year drug-free communities grant for youth prevention. Their coalition focuses on youth prevention, and they work very closely with the Cable County schools and do a lot of peer-to-peer advocacy and training for that kind of advocacy and support. They also focus on adult and youth drug courts in the River Cities area, and work closely with their health department and the harm reduction programs So they sponsor prescription drug drop boxes and needle disposal sites throughout the county that they serve. So a lot of the work that they've been doing since 2006 is they do an annual drug prevention summit, and they bring together stakeholders to focus on strategies and resources to meet the community needs to address the crisis in the River Cities area. They host an annual teen summit with the school system, and youth are trained to be peer-to-peer trainers and advocates to help prevent the use of opioid and other substance abuse with their peers. The coalition and the United Way in River Cities provides free drug kits to the public. They provide them especially for parents and caregivers with training on how to talk to their kids and to youth about drugs. They use evidence-based prevention programs for youth and adult prevention. And they also do a partnership with the Marshall University, which is located there in Huntington. And they partner with their pharmacy students to provide safety training for elementary and middle school children about drugs. They have a Parents 360 program where youth provide education about substance abuse prevention with the parents, and then Youth 360 where there's peer-to-peer education. And again, as I mentioned, they partner with the county health department to promote harm reduction programs with disposal sites and syringe drop boxes throughout the county. So some of the challenges that they've faced in West Virginia, and a lot has been around changing the attitudes and perceptions about addiction as part of this crisis. So changing the language around addiction and drug abuse has been a large part of their public awareness campaigns that they've done, and addressing stigma. Where it's not just for the public, but even for those who are experiencing addiction as well, helping them to address the stigma that they themselves face, and helping them realize that addiction is a disease. You can't blame a person for their addiction, especially we know that just in the way that the opioid crisis came about, and that in large part, especially in West Virginia and in places like River Cities area, it was because of overprescribing of these opioid painkillers that got us to the crisis that we have now. They're doing a lot of work with employers and the business community to raise awareness and understanding about opioids and about addiction, especially focusing on how it impacts their businesses and their employees' well-being and productiveness. So when it comes to prevention and treatment, we recently had a presentation from United Way of Greater St. Louis, and they're doing a very unique treatment program in St. Louis area based on a gap that they saw there in the Greater St. Louis area. So they are doing they're addressing opioid addiction and treatment specifically for postpartum mothers. So as part of their program, they are partnering with 3 community-based treatment providers to treat postpartum mothers that have opioid use disorder. The opioid epidemic is a really large issue for Greater St. Louis. They currently fund $10 million in substance abuse and mental health programs with different agencies. They have convened providers, donors, legislators, and other community stakeholders to determine where the gaps were in their community to address the crisis, And they were made aware through this convening that there was a really large spike in children being born with neonatal abstinence syndrome and a need to provide addiction treatment for both pregnant and postpartum mothers who were addicted to opioid painkillers. Many uninsured mothers were receiving Medicaid for their pregnancy, but there was a gap in service because their coverage would cease 60 days after giving birth. So they developed a program with their 3 community behavioral health providers to provide funding to support the addiction treatment for these mothers, pay for their medication-assisted treatment, and provide wraparound services for the mother. But I think what's especially important about the program that they're doing in St. Louis is the spouse and or partner is included in the program. So they're working to support the whole family in a long-term recovery. The other thing that they're doing is they've developed a learning group with shared knowledge among providers in the area and identified opportunities for collaboration and provided them with tools to be better advocates in their community on addiction and treatment when it comes to opioids. So their program goals are fourfold: to provide extended medication-assisted treatment to uninsured postpartum mothers and their partners. They have at least 50 people total right now in their initial program. This is the first year of their program. And this is allowing them to stay longer in their treatment by providing this funding for this treatment. Their goal is also to reduce the likelihood of relapse and overdose, giving them more time to get connected with other needed resources in the community, and also by integrating work with their partner, helping to provide support for the whole family with that long-term recovery. They're tracking the outcomes and demonstrating the impact, including the number of people receiving treatment, the length of time in treatment, relapse rates, and overdose rates. They are still in their first year. This is the pilot of the program. And so we are still waiting to see what the data is going to show us at the end of the first year. And they are currently seeking funding partners to broaden and continue the work in the St. Louis area. So the criteria for this program is the mothers and their partners have to consent to participating in the project. They are either uninsured or underinsured. They have to have been diagnosed with a substance abuse disorder. Could that be opioids or opioids plus alcohol or marijuana or other drugs? They are at least 60 days postpartum or can verify that a pregnancy ended or are parenting a child under the age of 3 if they are beyond that postpartum stage. The services included are initial assessment, behavioral health care, medication-assisted treatment, drug screens and labs, psychiatric visits, coordinated case management, and referrals to other wraparound services to support the family. And so I mentioned that they are establishing a learning community among providers and other agencies that are serving the opioid use disorder population in St. Louis. The purpose of the learning community is to integrate care, share best practices among providers, successes and challenges to more successfully addressing the opioid crisis in our community. The learning community also strengthens the ability of providers to be advocates for opioid prevention and treatment, both at the local, state, and the federal level. And I mentioned the 3 community partners that they have in St. Louis are the Perinatal Behavioral Health Service at Washington University School of Medicine, the Women and Infant Substance Abuse Center at St. Mary's Hospital, and places for people that provides comprehensive medical and behavioral health treatment and counseling, especially for low-income minority populations in the area. So moving on to trauma-informed care, and just again a caveat here, Greater Philadelphia is just one United Way that are doing work in states around trauma-informed care. It's actually very predominant across our network. United Way Central Iowa has a really very successful 10-year program they've been doing around trauma-informed care that not only involves programming, but also involves advocacy and policy issues at the state level to integrate trauma-informed care initiatives across the state. We see significant work in trauma-informed care happening in Tennessee and in Wisconsin. So a little bit about Greater Philadelphia.
Jay, this is Dana. We have about 3 minutes left on the webinar, and I just want to check in with Holly to see if we run over a bit, if that's okay, or will we be losing the line?
That's okay. We won't lose the line if we go over a few minutes.
Welcome to CenturyLink. Please hold while I confirm your passcode. Thank you. Your passcode is confirmed. When you hear the tone, you will be the 4th person to join the meeting.
So, so the trauma-informed care initiative in Greater Philadelphia is to build capacity for both the public and private sectors to integrate trauma-informed principles in their work, help prevent, mitigate, and heal the impact of highly stressful childhoods. So their initiative involves training and education, independent research, getting the community engaged, and then also around advocacy policy. They've also published 2 volumes of their trauma-informed philanthropy guide, and I'll actually send the link to this to you, Dana, so you can share that with your folks. It really addresses how the importance of having trauma-informed care across the broad spectrum of the communities in Greater Philadelphia. Just real quick, ACEs, they've done a lot of work in tracking ACEs in Philadelphia. You'll see by the chart here that in Greater Philadelphia area, instances of ACEs is much higher than we're seeing in national samples from Kaiser and other organizations. So there's a lot of issues that are driving this in the Philadelphia area. A lot of it has to do with poverty, with joblessness, and substance abuse and domestic violence in the area. A lot of their work around this has been, in trauma-informed care, has been destigmatizing addiction. The first step is changing the language of what's wrong with you to what's happened to you. So there's a real robust public awareness campaign about addiction and the impact that this has on childhood trauma and toxic stress. A large focus on their work is on healing and resiliency. So as I mentioned, they have a partnership with, we have a campaign for trauma-informed policy and practices as a national organization to access, educate, and advocate for members of Congress in the Philadelphia area, and they've created a resource guide for supporting trauma-informed practice in Delaware Valley. So that's it. So if we have any questions,
Thank you, Dave. I think, there's a lot that you said that resonates for the communities we've been working with. And for me, a couple of the things were really around the need to address stigma in communities and change the narrative and language around how we talk about opioid use disorder and people and families impacted by it. I think one of the other things that really stood out for me was the work that's going on in St. Louis to really address neonatal abstinence syndrome and mothers experiencing OUD and babies born as a result of that. I do want to take a few minutes to thank you so much for being willing to share these examples, because I think there's a lot in these three examples, and Huntington, West Virginia has certainly been one of those national models of communities working across the continuum, even looking at, working with their business community. And I know that's a challenge, but we have in our cohort a group, a couple of counties that have been really interested in how you talk to employers and work with employers to understand what it means to, quote unquote, be trauma-informed employers and businesses. So thank you for sharing that model. I'd like to open up now. I understand from Holly and Tyra that we've had a couple of the webinars run over and that hasn't been a challenge. So I do want to stop to open up to see if there are any questions from folks on the call today. And you can type those into your chat box, or you can just unmute, and if it's quicker, to unmute and ask a question. So it doesn't look like we have any specific questions coming from folks. So I thank you, Dave, and I also want to just go back to your offer to share the trauma-informed advocacy guide. We're really interested and curious to look at that, and also curious to look at the campaign that's going on for trauma-informed policy and practices. That is really intriguing, so thank you for bringing those up. As a closing and next step, if anyone on the call today would like a copy of the presentation and have not already done so, I just want to remind you to type your email in the chat box. This recording, along with our other recordings, will be posted on the Community Collective Impact Model for Change website, which you see the email to here. Dave, thank you again today for generously agreeing to participate and taking time to share those strong examples of how communities are working and how United Ways are working in their communities to invest in addressing the opioid epidemic and being involved as leaders and as a part of those coalitions in their communities. So thank you so much.
Thank you, Dana, and please keep me in the loop. I'm very interested in the work you're doing on the ground there in Ohio, and think that what you're doing really can be something that we can highlight and share across our network as well. So keep me in the loop. Yeah, we will definitely stay connected with you guys. And then the next webinar, as a reminder to our participants in the series, will be on Monday, February 11th from 2 to 2:30 p.m. Eastern Time. And it will be on SIF-RX Interactive Prescription Drug Disposal Map, and Tessa Miracle will be the presenter. And I'm sure you will receive additional reminders, but it is this coming Monday, February 11th. So thank you all, and that will conclude our webinar for today. Thank you.